Rhabdomyosarcoma (RMS) is a rare type of cancer that arises from soft tissue, specifically from primitive mesenchymal cells, which are the precursors to skeletal muscle cells. It primarily affects children and adolescents, making it the most common soft tissue sarcoma in this age group. Rhabdomyosarcoma can occur in various locations throughout the body and has different subtypes, each with distinct characteristics and treatment approaches. Overview. Prevalence. Rhabdomyosarcoma accounts for about 3 to 5% of all pediatric cancers, with approximately 350 new cases diagnosed in the United States each year. It is most commonly diagnosed in children under 10 years of age. Types of rhabdomyosarcoma. Embryonal rhabdomyosarcoma, the most common subtype, often seen in younger children. It includes several variants. Alveolar rhabdomyosarcoma typically affects older children and adolescents and is more aggressive. Pleomorphic rhabdomyosarcoma usually occurs in adults and is characterized by large, abnormal cells. Botryoid rhabdomyosarcoma, a variant of embryonal RMS that forms a grape-like cluster in hollow organs, commonly seen in the vagina or bladder. Causes and risk factors. The exact cause of rhabdomyosarcoma is not well understood, but several genetic and environmental factors may increase the risk. Genetic syndromes. Certain inherited conditions are associated with a higher risk of developing RMS, including Li-Fraumeni syndrome, Beckwith-Wiedemann syndrome, neurofibromatosis type 1. Previous cancer treatments. Children who have received radiation therapy or chemotherapy for other cancers may have an increased risk. Family history. The family history of rhabdomyosarcoma or other cancers may also contribute to risk. Symptoms. Symptoms of rhabdomyosarcoma depend on the tumor's location but may include localized tumor symptoms, swelling or a mass, often painless and may be felt under the skin. Pain, depending on the tumor's location and size. Compression symptoms. If the tumor presses on nearby structures, it can cause dysfunction. For example, a tumor in the head or neck may affect vision, hearing, or breathing. Systemic symptoms. Fever, fatigue, unintentional weight loss, anemia. Diagnosis. Diagnosis of rhabdomyosarcoma typically involves several steps. Medical history and physical examination. Healthcare provider will assess symptoms and perform a thorough physical examination to identify any masses or abnormalities. Imaging tests. Ultrasound, used to assess soft tissue masses. CT scan or MRI. These imaging studies provide detailed pictures of the tumor and surrounding structures, helping to determine the extent of the disease. Biopsy. The definitive diagnosis is made through a biopsy, where a sample of the tumor tissue is examined under a microscope. Different techniques include fine needle aspiration (FNA). A thin needle is used to extract the sample. Incisional biopsy. A small part of the tumor is surgically removed for analysis. Excisional biopsy. The entire tumor is removed, if feasible. Staging. Rhabdomyosarcoma is staged based on the tumor's size, location, and whether it has spread to other parts of the body. Staging helps guide treatment decisions. Treatment. Treatment for rhabdomyosarcoma typically involves a combination of therapies. Surgery. The primary treatment is often surgical resection to remove the tumor, if completely feasible. Chemotherapy. Systemic chemotherapy is commonly used before neoadjuvant or after adjuvant surgery to reduce tumor size and eliminate remaining cancer cells. Common chemotherapeutic agents include vincristine, actininomycin D, and cyclophosphamide. Radiation therapy. This may be used in conjunction with surgery and chemotherapy, particularly for tumors that cannot be completely removed or in cases where there is a high risk of recurrence. Targeted therapy. Research is ongoing into new therapies that target specific genetic mutations and pathways involved in rhabdomyosarcoma. Prognosis. The prognosis for children with rhabdomyosarcoma varies significantly based on several factors. Stage at diagnosis. Early stage disease generally has a better prognosis than advanced stage disease. Tumor location and size. Tumors located in favorable sides, e.g., the limbs or trunk, tend to have better outcomes compared to those in unfavorable sides, e.g., the head and neck. Histology. The type of rhabdomyosarcoma, embryonal versus cellular, also affects prognosis, with embryonal RMS generally having a better outcome. Overall, the 5-year survival rate for children with localized rhabdomyosarcoma is around 70 to 80%, but this drops significantly for metastatic disease. Conclusion: rhabdomyosarcoma is a serious but treatable form of cancer that primarily affects children. Early detection and a multidisciplinary approach to treatment can significantly improve outcomes. Parents should be aware of the signs and symptoms of rhabdomyosarcoma and seek medical evaluation if they have concerns about unusual masses or persistent symptoms in their children. With advances in treatment and ongoing research, the prognosis for children with rhabdomyosarcoma continues to improve. Regular follow-up care is crucial to monitor for potential late effects of treatment and for any signs of recurrence.